Maine right now is building a new system to ensure that one of the state's most vulnerable populations receives consistent care. The Lifespan Waiver is expected to clear out a backlog of hundreds of children and adults who have intellectual and developmental disabilities and provide new programs.
But some parents whose children have spent years waiting for housing and support worry they won't get the care they need. News Center Maine's Vivian Lee has our update.
Watch what you're doing.
The Lifespan Waiver would start providing services to people with intellectual and developmental disabilities at age 14.
Yeah.
To help them move forward from school-provided services into adulthood without losing that care.
And that has been the vision, really, of Lifespan from day one, is to try to not have gaps, not have people fall off the cliff.
Betsy Hopkins is the Associate Director of the Department of Health and Human Services Office of Aging and Disability Services. Families with special needs children must apply for different waivers for home and community services based on their needs.
Miss you. How have you been?
Primarily paid for by federal Medicaid dollars. The agency plans to roll out the waiver for youth 14 to 17 in the fall of 2025. Adults receiving housing, direct care, and support services through Section 21 and 29 waiver programs could also be eligible a year later.
That could be an option for them to switch to the Lifespan Waiver and look at the service options that would be available to them. And Lifespan Waiver, for those who need it, would expand.
Hopkins says the goal of the Lifespan Waiver is to clear all of the wait lists for waiver-funded services in 5 years. More than 2,100 people are on a wait list for Section 21, the highest level of support for people who need one-on-one supervision in residential housing.
And I'm worried about promises being made to my daughter that might not be kept.
Lisa Wessel's daughter, Lydia, has a seizure disorder and a rare genetic condition that has impacted her cognitive abilities. She has spent 6 years waiting for a placement in a group home under Section 21. While Lisa supports expanding and adding new services, she questions how a new care system will become a reality if barriers like workforce shortages persist.
There aren't enough direct service providers. There aren't enough case managers. There isn't enough housing, affordable housing.
David Cowling's son, Jay, has an intellectual disability and mental health challenges. He has lived in a group home in Bath for 25 years. Under the Lifespan Waiver, people can stay in their group homes. However, he still worries about possibly having to care for Jay as an aging parent.
As you see the attrition of group homes throughout the state because of lack of staffing and financial challenges, you realize it could be death by 1,000 cuts.
The agency says it's hired a housing counselor to connect families with federal and local housing authorities and help caregivers rent apartments where clients could receive care. ODE's officials continue meeting with parents and advocates throughout the state and are making changes to the waiver. The public will get to comment on the final plan later this summer. Vivian Lee, News Center, Maine.